So vitamin D is necessary for normal immune function. People with low levels of vitamin D will have reduced levels of immunity. And this does seem to predispose them to viral infections and to bacterial infections. We don't get too much vitamin D from our diet. A lot of vitamin D comes from the sun. And the other important point here, and this explains or may explain a lot of the data we're seeing, is that the darker your skin, the more slowly you produce vitamin D. In COVID-19, if we remember our alveoli diagram like this, these hollow bunches of grapes, these alveoli, where the air goes in and out. So that's the bronchiole, the air goes in there, we breathe it out there. And the oxygen goes from there into the blood, and the carbon dioxide goes from the blood back into the air to be breathed out. Now, part of the problem with COVID-19 is that people can develop ARDS, acute respiratory distress syndrome. And that is basically an inflammatory condition. So what happens is the alveoli and the airways become inflamed. And they become inflamed because of these pro-inflammatory cytokines. So they become inflamed. And then, like when you sprain your ankle and it gets swollen, fluid comes out. So we get fluid collecting in there. And that means we get what we call consolidation and infiltration in the lungs. They fill up with fluid and therefore they don't work. Therefore the person gets no oxygen in their blood, therefore they can die. It's that simple. So that's how important these inflammatory processes are. So to keep down pro-inflammatory cytokines and infection is usually a good thing. So in COVID-19, we know that the case fatality rate, the number of people that die, goes up with age and goes up with other diseases. And both of these, other diseases and increased age, are associated with lower concentrations of vitamin D.